All right, so let's get started on what we need for a treatment of neuromodulators or Botox. So we already have our station area set out here. I'm gonna go ahead and get all of our supplies we would need for the service. All right, so first things first, we need some alcohol wipes. We need some gauze. Of course, we need our insulin needles to administer the Botox. We need some normal saline, sodium chloride solution to put into the Botox vial. This is our Botox vial here. We need our marking pen or just eyeliner to mark our areas and make sure that we know exactly where we're going to be injecting the solution. Next is our wound and cleansing spray to make sure that we keep our area nice and clean. And then some numbing cream for some people that don't have a high pain tolerance. I'll put this on them to help with the pain as far as injections as well. And that's pretty much it. So then what we need to do is draw up some solution of sodium chloride and inject this into the Botox vial so that we actually have our Botox solution to inject under the skin. Once we've done that, then we can draw up with the insulin needles and our doses for what we're going to give our client of Botox in here, and then we're going to use these needles to inject the Botox underneath the patient's skin. We have to, if they want numbing cream, I'll put the numbing cream on for 10 minutes, let that kind of like numb their skin. Then we have to wipe all of that off and use this disinfecting, like cleansing first aid spray to make sure the area is nice and clean. And then we're gonna use our marking pen to mark the areas that we need to go so that we know exactly where we want to inject the Botox. As we're injecting, we're gonna need gauze because the patient is gonna bleed. So you need to make sure you're wiping the area, and of course you're gonna keep wiping with this same first aid wound care spray. So that's pretty much how we do it. Then when we're finished, we're gonna, cleanse the whole face, wipe it down, make sure we're all good, and the patient isn't walking out looking kind of crazy. That's pretty much all the supplies that we need to do a treatment of neuromodulators.